Okay.
All set? Ready to go? Okay. Welcome back to the Acu Health NJ Notcast. We were on hiatus last week. We're glad to be back. So fresh off the course, we did the course Epigenetic Mechanism for Women's Health, how you can influence and improve the tissue of the reproductive organs, ovaries, and uterus through the genome, through the positive expression of upstream and downstream chemicals in the body, and the end game is to have a successful pregnancy. That was a hit. A lot of people were impressed by it. Thanks, Greg, for setting that up. That was actually a bit challenging. Dealing with the administration of any university or college was very challenging. So I commend you on being able to solve that Rubik's cube.
It helps. They're very helpful, so they make it not a difficult process.
But Greg's up to some good stuff. So Denim Day. What is the significance of denim? What is it all about? And tell the listeners and viewers what we're up to.
All right. So from what I understand, Denim Day is already a thing. It's not one of these that they invented, but it's essentially to counteract that notion that when a woman gets assaulted, right? What's one of the questions that you used to hear, like, what was she wearing or what was she doing?
Oh, okay.
So the notion of Denim Day is like, listen, it doesn't matter what we're wearing, like we can get attacked. And listen, guys know that that's true, right? It's like, no way. We know that the person doing this heinous act isn't necessarily considering, their attire. It's due to whatever pathology or whatever situation is happening in their own head. But unfortunately, in the society, we like to put the onus on the woman.
Right.
And granted, I will say, just to be fair, there is some bit of wisdom to some of those things. But however, once you cross the boundary into assault, like when somebody's assaulted, their clothes have no bearing on the situation. So Denim Day is just a day that to remind us of that, and so you're just wearing denim, just kind of like it's a neutral thing, right? Like denim, nobody really thinks of denim as like the fashion choice, right? I would see you wearing a Canadian tuxedo anytime soon as a.
No, but people do wear jeans.
What?
I've seen that.
Oh yeah, people wear jeans, but the thing is, like, I don't know about you, but like nobody wears jeans when they're trying to make a statement, right? Jeans is just like it's like jeans.
There were designer jeans for a while there.
There were.
High-end.
There were.
I'm sure they're still around.
Yeah, but I don't know. I don't think they caught on, right? I think it's just a way to trick people to pay extra money for things. Like, as a fashion choice, though, nobody's like, Antoinette, when you're going out, like, you're not just saying like, oh my God, I can't wait to put on those new jeans, right? It's like you might get a pair of jeans that looks nice, but generally as a class of, article of clothing, I don't think jeans are necessarily that high on the list,
Well,
right?
during that stint with the high fashion jeans, I did go a little deep on the denim and
Skinny jeans?
No, well, you didn't have a choice. They were just cut skinny. Not that I went out and got skinny jeans. I think they were appropriate.
Okay.
And I don't want to fat shame, fabric, but
Careful.
they were snug and they were like kind of like comfortable. So it was like it was a thing for a while. I don't know anymore because after COVID, I just wear scrubs all the time. But for a while, they like the denim and the jeans was like a thing, and they did fit real nice, and the fabric was soft and.
Especially now they got those. They're kind of like they feel like half jeans, half yoga pants.
Yes,
they're like
we
elastic.
started putting a lot of like elastic fibers to make them a little bit more stretchy and comfortable. But I will say this about jeans: they should be dark, right? They should start dark.
Physical jeans or like the clothes?
Pants.
Okay.
The pants should be dark, a dark, what do they call selvage, or like a dark blue, is my preference.
Yeah.
And under no circumstance should anybody ever spend money with jeans that have holes in them already. Like that's a no, for me, and I'm putting my foot down on that, and fading and washing.
Do you know the story behind that? We can tell a little denim history.
Please, go ahead.
Well, at least I don't know about in ubiquity, but I know in at least the what's the word? The what's it called? The historiographical, like the legendary mythological version is that in Eastern Europe, like all the food and all the clothes distribution, it's not like it wasn't stylish and colorful during communism. It was just like, here's your jeans, asshole. That's it. And people would stand in line to get these dins. Government issue, all jeans, ugly, right? And of course, right, the women weren't going to stand for that, right? So they were looking for ways to make them unique. And so what they started doing is they started putting these tears at different places. And so that was their way of like asserting their individuality under communism. And then of course Americans took it and we popularized it. So.
I always wanted to get my own holes in my jeans, playing outside with grass stains.
Yeah.
And I remember back in the days, the metal jeans, you were a poser if you bought jeans with holes in them. So you had to work hard to get the hole in the
Yeah.
I remember I got one on my knee, and then my grandmother, again, survivors of World War II, who didn't waste anything, took the pocket off the back and sewed it on
Yeah,
to patch the
that is-
jeans because she wanted to save my jeans. I worked really hard for that hole in my pants, and I was like, oh man, everybody's gonna laugh at me when I go back and I wear it, but who knows, like it became a thing. The back pocket on the knee became a trend. Thanks, Grandma.
Yeah, I remember.
But don't ever buy jeans with holes in them.
I don't know if I can keep
Swiss
that from-
cheese jeans, like do people still
Oh,
wear them?
okay, but let's really narrow it down. What do we classify as a hole? Because we got those ones like the little pocket, like a little spray. It's not kind of
There
hole. It
should be
hasn't,
no corruption of the fabric.
no corruption,
Off the
incorruptible
shelf.
fabric.
Yes, it should be a solid, and you should wash your jeans inside out
Version
to
board.
maintain them, to maintain the nice dark, selvage color of the jean.
Okay. I don't know, you're putting a lot of rules for denim.
Yeah, yeah,
Why not?
and then I'm calling the fashion police. Like, I think there should be a minimum height on a cuff, because I'm watching people wear the cuff up to their knee now. What's going on with that?
I don't know what's going on.
I don't
with
wanna
that.
be grandpa,
I'm old
but-
too now. I'm old
Yeah.
too.
Yeah?
The kids are saying, doing
Okay,
stuff,
so-
it's confusing, it's weird, I don't know.
It's not the kids, it's the adults who are trying to mimic the kids, but that's absurd, so,
Careful, Doc.
yeah.
No, but yeah,
But what does it have to do with 180 in their,
so I believe it's Tinton Falls. One of the teachers, she wanted to promote it, and so she's promoting it and helping to spread awareness about 180. There's been an exhibit this last month called the What Were You Wearing Gala, where women who've unfortunately suffered abuse, they have what they were wearing that night, and then they talk about it, and they talk about the stigma and what happened, their experience. And it's I haven't been there because, obviously working hard for here and like promoting things, but I have seen clips on Instagram, and it looks like a really powerful thing, because I don't think people understand it. That's why we're getting involved. Like, I think people don't really see the impact the way that you and I do, and we don't even specialize in that. Just like from just happenstance, right? When we find out a patient might have had an experience, or when some of their experiences are interfering with the fertility process, because as you know, cortisol, right?
right?
The porch pirate is preventing the connection between the hypothalamic pituitary ovarian axis, right? It's so cortisol's getting in the way, but as we know, these old traumas, right? Even if they're many years, if the person's still going through the emotional dysregulation, they're going through those adrenaline spikes, then they're still living that experience, and so it can not only affect their quality of life, but if they're trying to get pregnant, right? Working through some, at least the physical mechanism, right, with the therapist as well, tends to, increase the treatment outcomes. So I feel that given those things, and also the tip that one of our patients gave us about how women are most vulnerable to a domestic assault when they are pregnant, which is counterintuitive, right? We're just seeing how, like, all of these aspects intersect with what we do on a daily basis. This isn't, for us, it's not remote. And so by bringing awareness to these things, we can help our patients, right, the people that are coming to us, get the help that they need, right? Because the truth of the matter is, no matter how good, no matter how well we listen, we're not qualified professionals to help them through
No,
there.
and I think if we haven't mentioned it before, we're definitely gonna mention it now and say that whatever adverse experience that you're going through, whether it's adverse childhood, physical, sexual type abuse, there's no amount of acupuncture that's going to, yes, it's okay for now to kind of get you out of an acute state, but the most important thing is acknowledging and getting that patient the right kind of help, because it's foolish to think that acupuncture is a long-term solution.
Yeah.
So when we do intakes, and we ask about anxiety, we always ask about trauma, because when it comes down to trauma, working in substance abuse, which kind of overlaps with a lot of these things, nobody wakes up one day and decides to be a drug addict. And abuse, childhood or adult, is part of it. And to me, there's no, and for somebody who's experiencing that sort of like trauma, you said the thoughts and the memories, there's no magic eraser that goes back and eliminates that. And to reprocess or to work through it, it's very triggering. So being able to acknowledge and identify and get the help for them. But when you're living in that cycle, there's no, you need, it's very important to get the right kind of help, and it's good that we're working with 180 and that you're reaching out to them, because it is a critical part. Now, if it hasn't been said, let it be said here that any sort of violence against any individual is frowned upon, women, children, everybody. So why don't we smack our kids around anymore? Because it sends a signal that violence is a tool to remedy a situation, but what it is violence just begets more violence, whether against a child or a woman, but somebody who's been exposed or in an environment like that will almost let it slide and say it's part of it, but it's never, ever, ever, ever. And downstream, in a clinical situation, that's why we want to acknowledge and get the patient the right kind of help. Because if we're treating the patient over and over, we're managing the symptoms and we don't know about it and they're not getting better, then we have to kind of intervene on the bed. But sometimes in the environment that we kind of create, whether it's substance use or in the treatment clinic, people, when you inquire about these 10 questions in Chinese medicine, people kind of say, well, this doctor or this care provider is listening to me, and it kind of slips out. And it's very important to create the environment where people can share these things so that you can get them help. So you know what, this isn't for you right now, this is for you. Make sure you stick with it, or how can we get you out of this immediate situation? So tell us a little bit more about your dealings with 180.
I will, but just one point. I think people don't have to understand too that this is one of the most underreported crimes that we have, right? Like assaults against women or men, but generally women, domestic violence things are generally underreported. And not even that, even when they are reported, they're not always taken to the full extent of the law, right? Sometimes a couple gets in a spat, somebody gets hit or shoved or pushed, whatever have you, and then people become remorseful and they say, no, I don't want to press charges, but then 2 weeks later, the police are back at the door because another incident has taken place. And again, the victim will sometimes plead on the abuser's behalf. So it creates this vicious cycle. So I just want people to understand, like, it might be intuitive to us that, this is wrong, we should do it, why are we spending so much time on this? But as your point about trauma, like, people don't understand when you're in a traumatic situation that's unhealthy, your coping mechanisms could further your unhealthy lifestyle. Meaning that when you're with a partner that's abusing you, but you also love, that contradiction creates a cycle where, okay, you're abusing me, but I also need you, so it's not always obvious to the person before it gets dangerous that you should leave, right? I have this joke, because I know it, and you know it too from treating the clientele that we do, like, every woman has at least one friend that is with a guy that's hitting them, and they still have, for whatever reason, they haven't left yet. So it's like, it's a continuing boiling pot on the back burner that is slowly boiling over, and it's going to spill out and cause a problem. And I think that by highlighting that, 180 is one of the few organizations that, if a woman's in a bad situation, she can get help that night. And so that's what I'm trying to get people to understand. It's like, people don't need to stay in these bad situations, because there's the woman that we have to think about, but there's also the man, because he's probably needs some kind of help, even though once he does it, he needs to go through the justice system.
About violence? Violence only
Because-
gets more violence.
Right.
I'm not trying to condone that behavior. We're all responsible
Right.
for our behavior, but a person like that is obviously a product of that environment where it's never okay.
Yeah,
But in that environment it was.
yeah.
Right, and that's wrong.
Exactly, but then that's where re-education comes in. And honestly, like, not to make it too esoteric, like, there's also a social aspect too, where, police officers have told me that the DV calls are amongst the most annoying calls that you have to have, right? Because you're going to a situation where, after a while, like, people can see the pattern, all right, he hit her, she called the police, he's remorseful, she doesn't want to press charges, and off we go. And so, like, you're a police officer, and you have to go to this couple again when you know the story already. And sure, there are laws to kind of prevent these things.
We should invite a police officer down, because my understanding, if there was a domestic violence call, I think at this point, both people would go, get locked up.
I don't think it's there. I think
No.
I mean, I'm not.
We'd have to get one of them to, we'll get a police officer, we really should get somebody in here to talk about that, because it's important now. One of the things we found out recently about 180 is not about domestic violence. We had a patient who was a victim of campus rape, and the good people at 180 told us that they have resources for that too. It doesn't have to be domestic violence. Any sort of adverse experience, physical, sexual, there are resources within 180 for that too. That's important to point out. I wanted to clarify that.
I say domestic violence, but I really mean all crimes against women, right? And I say domestic violence because I'm taking that aspect, because that's our clientele, right? Because we're looking out for patients, because, I mean, at the end of it all, what people might not get, like, we're not a normal doctor's office, right? Like, we can't, like, we get involved. Like, if a woman's coming to you saying that I'm having trouble, and you've been doing this for 20 years, if she's telling you that I'm having trouble getting pregnant, I want to have a child, like, that's an intimate process, right? That's, like, you kind of have to get to know them. You see, like, how motherhood changes them, their anticipation, how they go through it. Like, it's not something where, you know, we just see you for 20 minutes and then we leave, right? Like, you might get in another doctor's office, right? Oh, like, oh, you can't make it in, we'll see you in 3 months, right? Like, we're constantly checking on our patients, seeing how you're doing, walking through them after transfers don't work, because listen, it happens, right? Transfers don't work, but like, the level of involvement we have in people's, like, you know, personal lives with their emotional state. When we're talking, when you add domestic violence into the mix, like, we can't reasonably treat our patients to the degree that we need to when this very prevalent and underreported problem is affecting our treatment population, right? It's like, it's just, we can't do our jobs effectively if this is happening and people are not taking this seriously, because I think you said something to me last week that, like, you just don't hit girls. Like, you just don't. And I was like, yeah, that's how I was raised.
Right.
But I think people are missing that. If you don't explicitly tell children what to do and what not to do, it's going to get forgotten. And so I think that we've kind of had a dereliction of duty, because now it's starting to become in vogue amongst, like, you know, people to say, like, oh, well, we know we shouldn't hit women, but like, if a woman comes at me, then I have free reign to hit her. And I'm like, well, not really.
No.
You know,
No, that was never a thing.
You know, yeah, but now it's like equal rights, equal lefts, right? That's like
No, well, here's the thing. It goes back to like the martial skill ability. It's like you don't have the skills to protect yourself from somebody. Then you know, it's on you, and it kind of like, you know, brings you down a few levels. But one of the things I recently found out, and this, I mean, to some degree, it doesn't have to, it is a domestic violence thing. One of the things that we brought up earlier on in the conversation is about victim blaming. Like, what did you do wrong? And I remember, of all things, which I probably don't fit the profile, Octavia Spencer, her show on Apple, Truth Be Told, about a true crime podcast, which again is not my, didn't involve dwarves or wizards or aliens or robots, so I don't know how I ended up getting hooked on it, but I learned a very big thing, is like they started using the term human trafficked, right? As opposed to prostitution, or calling her a prostitute. This woman's a prostitute. And I'm like, why are they taking so much time to say these words out loud? And I realized that words like prostitute actually puts the onus, like you said, on the victim. It said she left home. She left this stable, who God knows what was going on at home. If it's bad enough where you gotta leave home and you're going, you know, work from out of the frying pan into the fire, then it's really bad. Now that patient, or that person, sorry, or that actress or whatever, that person, that situation, that goes into the situation of prostitution. It's like, well, she left home and now she's a prostitute, she's a hooker. I mean, these people are generally frowned upon in the view of society, but when you say human trafficked, it is a sort of a manipulation game where this person has left the only stable environment, which was violent to begin with, and goes into another violent situation for stability, and now is trafficked and didn't get there, right? Didn't happen overnight. Like the same thing with like the addict. Nobody wakes up one day and decides to be a drug. Nobody wakes up one day and decides to be a prostitute. They're no longer a prostitute. They are now human trafficked. Somebody put them in that situation, whether it's arm twisting or physically beating or putting them in a situation. And it doesn't have to be that runaway. It could be any person now, especially with like predators online. Anybody could be. I mean, you could be manipulated to be a war bride for an ISIS person in Syria or something like that. That's the level of like where it's gotten to, and I'm sure there's a shared domestic violence involved there. But any person who has is in a situation where they're a victim has these resources that they can reach out and get the help, and I think that's an amazing thing.
Yeah, because we know it's going to be very difficult aside from education, which I wanted to ask you about that in regards to being a parent, but we know that aside from education, that the only thing that we can do is make it easier for people when it happens to say something, to know that it's safe. There's not going to be a consequence for you for just reaching out to these people who will help you, right? They don't understand that there's a whole team of people whose sole job is to help women in their situation. I think when you frame it that way, that, you know, there are people out there who are waiting for these people like you in your situation to call so you can get help. I think that it's important for women who are in bad situations to know that you're not alone. You're not, and we have all these jiu-jitsu gyms, these police officers, like there are people who will stand up for you. And I just think April 30th is a good way for people to know that, because it's not going to them specifically and saying like, hey, what's happening at home? It's kind of just putting it out there so they can take the first step when they're ready.
The other thing too that needs to be, it's all well and it's great to have these resources, but sometimes it's hard for people to reach out and take them because there is this aspect of shame and embarrassment, right?
But that's about what?
That's, well, again, being in that situation, I think it's not easy. It's not an easy thing to go through. It's probably an even worse thing to address publicly.
Right.
And think about it, you gotta like, like even if you have children, you're thinking, I gotta destabilize their environment and put them in a bad situation. Or personally, if you don't, like you still have to kind of admit that maybe that you're with the wrong person, or that I think for the mindset of the patient is complex, and I think one of them is the stigma of being with someone who's like that, like having to suffer that shame, like I made a wrong choice, or I'm with this person, or whatever it is. But we're not here to rationalize it. We just want to say that you don't have to feel that way.
I'm with you, but what about their stigma? What about the abuser stigma? You know,
So
like, we're so like.
So what are we gonna do? We're gonna put the Batman suit out there and go out and beat on this guy?
I mean, listen.
Maybe we should, maybe we shouldn't.
No,
but it goes back. That person obviously needs to be immediately under the suffer the penalties of the law. Like the law we have. If you put your hands on something, look, we have laws against that. Whether it's a woman, child, person, man, other man, person, it's called assault, right? You get locked up. You get the handcuffs on. You put the orange jumpsuit on, and you're going up the river, right? That's what I think is the complication, because it's so personal. So I don't want this guy to go up the river even though he's beating me. That's what I'm talking about, the shame. That person who did put their hands on you, at the very least, needs to go up the river to realize that that's not something you do. Right?
And listen, well, I think people have to understand, there's all different kinds of assault. And so we know that the people who are kind of like, on the fence, they're going to try to steal it. They're going to try to strongman it with like, the most sympathetic abuser, like, oh, he had a hard day at work, oh, this and that, like, oh, he didn't eat it.
We all have a hard day at work, right?
So we understand. So let's throw them out. Like, there are people who do this serially, right? They put women in bad situations, they serially assault them.
That's the whole human trafficking thing. There's a manipulator who's put the person in that situation, right?
Yeah, so I feel like, I've noticed that there's just this reticence I'm noticing among men, because, we've all had situations where if thankfully we weren't with somebody who was reasonable, they could have made it spin into a situation where we could get in trouble. I've known men in that situation. So I understand the reticence. It's like, wait, I don't want to get in trouble. But they don't understand, we're not talking about those situations. We're talking about like actual like malevolence. Like the person knows what they're doing, they do it, they don't care what happens to the person. And then they go and do it again to another woman or man or whoever they're assaulting. I think that's what people understand. Like, that's a scourge, and that is something that we need to tell. It's not enough to just not participate in it.
Right.
You have to also like socially shame those people not to do it. Like you have children, we're not gonna, but like I know you have daughters. Like no man wants their mother, their sister, their daughter to have another man treat them like that. You know what I mean?
Yeah, we have a hierarchy. We got grandpa with access to shotguns. So that's part of it, but we don't want it to get that far. And I think awareness is probably the first step. Like letting people know it does happen. There is help. It's okay. Acknowledging that there is some sort of, like you said, malevolence or malfeasance. Somebody within the power dynamic is creating that environment, whether it's the pimp and the prostitute or the home. It spans, and there is help for people. And I think the punchline here and the most important thing is to acknowledge the situation and get the help and know that there's resources.
And I think it's important for people to know that one of the things that's consistently reported by women who survive these kind of situations, whether it be domestic assault, rape, things of that nature, is that there is a physical component to it that people don't talk about. It after the situation has already passed, the fear, the PTSD, it creates these physical sensory distortion, in which you feel the heart's beating, the vision cues. So
that's what we did. There's no magic eraser.
Right.
So one of the other things that I will say.
One thing I've heard though consistently is that acupuncture is one of the few things that can get to that level, that
you heard it here first.
That equanimity to be able to process. So that's why your approach, which is do the acupuncture. Also, let's get you with a therapist.
Right.
because now you're in a place where you can talk about this.
I will say this, in the span of, and this also needs to be brought up, one of the things in our society is that, and it's good that you brought it up, is that the physical symptoms, is that once it happens, and let's just say you're safe, or you're not in that environment, people just assume that you have to get over it.
Yeah.
There's a pressure on society, and I've seen it a lot with adverse childhood experience where it happened in the past, and now that you're an adult, and then the severity, and there's extreme levels of severity, that because it's not happening anymore, that you need to be over it or move forward. I want to say that that is the magic eraser analogy that I use, is that there is not a magic eraser, and that person, whatever they've been through, it has, and that, not only the physical symptoms that you brought up, there is a sort of like psychological imprint that makes that person. Maybe they're guarded, or maybe they're antisocial, or maybe they're what they call a bitch. Why are you such a bitch? Maybe they came from an environment that was like, and that person is guarded, that needs to be addressed, that needs to be acknowledged, that it never ends, even though it never goes away, but it gets easier to live with, and that's a long, complicated process. And to say to somebody, oh, well, get over it and move on, is the worst, is the dismissive. And I'm glad you brought that up about the physical symptoms, because there is a long-lasting psychological imprint on that person that kind of shapes it.
Yeah, it's funny, like, get over it, like, people don't even understand what it is, like, that it is.
Well, you don't know what it is until you've experienced it.
Exactly.
And that's where it's hard for people to understand.
Yeah.
And let's just face it, it is horrible, it's horrible to talk about, it's horrible to, and that's why we don't, and that's probably why we don't talk about it, because it's so horrible, and that's why people get away with it. But let's talk about it today and say that it is a thing, but the worst thing is to have had gone through it and not have the help to get actually over it. And to tell somebody to get over it is probably one of the worst things to just say to somebody.
There's two things. It's get over it and it was your fault. Like, you know what I mean? It's like, what were you doing? But it's your fault. It's like, listen, we can, people can sit from where they are on their high horse and say, oh, that wasn't a smart situation. But I think most people can agree. It might, whatever you want to say, I'm not even saying, I think the majority of cases aren't even like that. But let's say somebody wants to find a case where like, well, maybe you should have been in that situation. Well, should the punishment be assault? Right? It's like, okay, go to somebody's room at 2 o'clock in the morning thinking it's going to be one way. The penalty for that decision should not be assault. You know what I mean? It should just be like, okay, I thought something, I'm going to leave. And the gentleman should be mature enough to say like, okay, it's not going to happen. He shouldn't throw a tantrum and like, you know, light her up like a Christmas tree. Like, what are we doing here, right? Not to make light of it, but I think people need to understand it. It's like, there are different things being talked about. Like, they're looking at the social game, like, well, you should be in that situation. But they're not looking like, wait a minute, a woman should not lose her life when they're in the company of a man that they're romantically involved with. It's just simple.
The other
There's
thing
no...
I think we're saying here is there's the assumption that this is an isolated incident. A lot of time with the victim blaming, the victim shaming, people have come from an already violent background where it's almost, you know, inherited, right? You're going, like I said, going from one bad situation to another. So that's why I'm saying, like, there's a long history. Nobody wakes up one day and decides to be who they are. And unfortunately, people who've been in that situation, maybe were in a situation like that before. It was an escape, like I said, going from out of the frying pan into the fire, and it's like learned.
Well, that's why important things like, you know, like Joe Dockery of Bayshore, like he has the women's self-defense class, which isn't just about physical self-defense. That's what most people think. He's a jiu-jitsu guy. He's just going to teach him how to like break somebody. But no, he also works with a police officer, whose name escapes me at the moment. But they go over the situational awareness. Okay, how do you not be in the situation? What are the cues? How do you know that this person has a bad intention for you? And on the other aspect, to bring Joe again, it's like we need more men of like who have gravitas, who have stature, to start educating the young men. Like we were educated, like, listen guys, like listen, we know that, like listen, we're all adults here, everybody listens to adult. We know that men drive women crazy, women drive men crazy. We understand, nobody's an angel. But people need to understand that hitting your partner, like if you're at the point where you feel like you need to hit your partner to get a point across, maybe you should put your hand down, take a moment, and walk it off. Like as a man,
I'm gonna backtrack that statement and say that violence and hitting somebody is primitive.
What? Oh,
it's
absolutely.
Primitive, right? It's a de-evolution. It's like going backwards. So if you are in a state where you can't rationalize it, then you have to use physical violence. You know, it's
Well, with your partner
it's walking
too.
back with anyone.
Well,
And yes, we're talking about domestic violence, but you know, violence, like we said at the beginning, violence only legitimizes more violence. It's
Right.
not a solution, right? So if we were to say what the solution is, it's like, definitely not that.
Yeah.
But after that,
I mean, Doc, based on your experience, have you had, I know you've had patients, respect to him, but you've had patients who've had experiences, obviously, as I have, but have you ever seen that dynamic, like, in the treatment room? Because, being in the particular field that you're in, fertility, IVF, like, sometimes a partner will come along.
not in clinical practice, but in rehab and detox, that was a big part of the conversation. Mostly, again, dealing with childhood experience abuse, in acts of violence like rape, domestic, or just circumstantial. That I did, and it's as a practitioner, you need to be prepared to handle that because it is ugly, and if you're not aware of it, you could handle it in the wrong way. One of the most important things, the first thing you need to do is ask if they're acutely, that's a not cast right there. We thoroughly encourage our phones to go off. I'm surprised the elevator didn't go off. But you want to, number one, and I think if we remember back to our schooling, we have a legal requirement at the very least to make sure that this person is safe.
Right.
Right? And then if you feel like the person's not safe, then it is on your responsibility to intervene. And that goes for suicide, it goes for any sort of like severe psychological. Are you a harm to yourself? Like you really have, are you in harm's way? You have to eliminate at the, what was it, Maslow's hierarchy of needs? At the very bottom, are you, or do you have, are you in a situation where there's a threat? We have to remedy that. Well, it's not with acupuncture, but it's about resources. And having 180 as a resource, I think is fantastic. I learned, and that was big for me, that there are resources for people. It doesn't have to be domestic violence. It can be things like rape in campus, rape and acts of violence.
Yeah, they also have they also work with Second Floor, which is for like teen bullying, or if a teen needs things.
We're learning something all the time. What is it? Second Floor?
Second Floor.
Okay.
So if like you have a teen that's like having a tough problem, or they're like suicidal, just need somebody to talk to. Second Floor is there to give them somebody to talk to. And I think, just to put a nice little bow on it, I think that people have to understand that these are community diseases. This isn't something that happens to like the Smiths or or the Williams family. Like that spreads out, right? Because again, there's an infrastructure requirement. Those children are going to school and acting out what they see at home, right? So people have to understand, like, if they want like stronger communities, if they want like happier children, and and they don't want this scourge to affect their family, right? Because you don't want your son to take your son to certain places. They start hanging out with a bad crowd when this is in vogue. Like people understand, we all have a part to prevent this from spreading and to bringing it down. And it's just about socially enforcing that this is not okay, and these resources exist for people. Because I was shocked to find out how many casual instances of assault that women kind of just forget about. And we as men hear the big ones, like something bad happened. But I know women who just like they don't even bother. Like, nothing's going to happen to that guy, whatever. But it's still horrific. And I think when people hear it like waved off like that, like, remember Ray Rice? Not to bring up a Rutgers alumni that made a mistake, but I think that it would have been a completely different situation if the video wasn't there, right? When you talk about like that guy hit his wife, it's just or that wife hit the husband. It's just like an abstract thing. But when you see these things, right? Like there are all these videos of these NFL players on Twitter, right? It's like when you see it, then you start to recognize like, no, like this is a real problem, because some of these shots, like this isn't make believe. This isn't like playing. Like women are getting ribs broken, orbitals shattered, lungs collapsing. Like there are things that are happening, and like those things take time, right? To rehab.
It also
work
takes
through
a
it
village,
emotionally.
right?
Yeah.
It takes a village for help, and we have the resources. We know about 180, and now we know about Second Floor. Thank you for that. But let's regroup. We're going to leave it today, and thanks for tuning in, and we'll see you all next week.